physician. I'm going to read for you today from a letter sent to Donald Trump on October 6th. It was written by the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Physicians, the American College of Obstetricians and Gynecologists, the American Osteopathic Association, and the American Psychiatric Association. Dear President Trump, our organizations, which represent more than 560,000 physicians, urge you to preserve guaranteed coverage of women's preventive services, including contraception. No woman should lose the coverage she has today. The ACA requires all health plans to offer coverage of women's preventive services. Over 62 million women with private insurance now have access to these vital health care services, including breast and cervical cancer screening, breastfeeding services and supplies, contraception and contraceptive counseling. Coverage guidelines were developed based on the best clinical and scientific evidence, and contraception is a key piece of this comprehensive women's preventive services package. Maintaining access to this existing coverage is critical to ensuring American women and families can access the care that they need. Contraception is an integral part of preventive care and a medical necessity for women during approximately 30 years of their lives. Access to no copay contraception leads to healthier women and families. Any move to decrease access to these vital services would have damaging effects on public health. We know that when women have unplanned pregnancies, they are more likely to delay prenatal care, resulting in a higher risk of birth defects, low birth weight, and poor mental and physical function in early childhood. No copay coverage of contraception has improved the health of women and families and contributed to a dramatic decline in the unplanned pregnancy rate in the United States, including among teens, now at a 30-year low. These rules will negatively impact access for women nationwide and will negatively impact our economy. No copay coverage of contraception saves money for taxpayers and state and federal governments. Unplanned pregnancies cost approximately $21 billion in government expenditures in 2008. Before the ACA, women were spending between 30 and 44% of their total out-of-pocket health care costs just on birth control. After the ACA, women saved approximately $1.4 billion in out-of-pocket costs for contraception care in 1 year. Changes to our healthcare system come with very high stakes, impacting tens of millions of our patients. Access to contraception allows women to achieve, lead, and reach their full potential, becoming key drivers of our nation's economic success. These rules would create a new standard whereby employers can deny their employees coverage based on their own moral objections. This interferes in the personal health care decisions of our patients and inappropriately inserts the patient's employer into the physician-patient relationship. In addition, these rules open the door to moral exemptions for other essential health benefits. Including immunizations. We urge you to immediately withdraw these harmful rules and instead partner with us to improve access to care for our patients. That was the letter that was sent to President Trump. Doctors know that the rollback of ACA protections for contraceptive coverage is not only an infringement on women's rights, but it's detrimental to their health and well-being. We must speak, and our congressmen must speak, against this latest attack on women by the Trump administration. Thank you.